Right. Oh, have we got any more?
So I
Well,
have to say, I have to give a not a disclosure, but well, I just had some body work done and my brain is a little scrambled right now. So hopefully I won't lose my words too much because it was pretty intense. It was
Shay
a
tells me
step.
this at 7:58.
Yeah, and I literally just walked in from it. It's called matrix repatterning. So they repattern your how your cells communicate.
Love it.
Yeah, it was really cool, but yeah, it's I don't feel as spacey as I did in the office. It's
That's
starting to come
good.
back to life a little bit.
Well, I mean, what we would love to talk about with you all today is really how to navigate your way through the planetary energies and the upgrade that we're having at the moment. However, it looks like we're going to be talking about pullback injuries. But be prepared that we can go off road. When Shay and I get together, we can go off road.
Yeah, you never know.
I'd also like to, you're all joining Shay and I in our 10th webinar together. We celebrate our 10th webinar together today. And she still replies to my messages and wants to join me on webinars. So I'm very happy. That's
How did
pretty
we
good.
even come about this one?
This one, oh, I think I just messaged you. We should do another one. What do you reckon? Actually, yeah, Shay, do you want to just let everyone know a little bit about your website and what we've got on there while I let people in?
Yeah, Emma and we decided to collaborate a couple years ago and do more like master classes on um, topics that we thought would be beneficial for people practicing craniosacral therapy or interested in it. We did the first one was on craniosacral anatomy, and then we did one on trauma through a biodynamic lens, and that's kind of be going to be what some of this talk will be about. And then we did one for Tears's group,
We did
and
two for her, actually.
oh yeah, I barely remember those because it was it was still like 3 o'clock in the morning no, it wasn't that bad, but
It was pretty
it
early.
was early. Um, and then the most recent one we did was on the fluid intelligence of the body. And I have all those on my website if anyone's interested in seeing them. The last one was my favorite.
It
All
was
of
a
them
lot of
were
fun.
fun, but that one was getting into the fluid dynamics, which is an important part of our anatomy that it doesn't ever really get addressed or talked about or anything.
Yeah. And we will touch on that today. This is really only going to be an hour. Um, and we're going to, it's not like a class. It's going to be kind of a relaxed, open conversation, which is why we thought we'd offer it as a complimentary webinar. I really like that word, complimentary webinar to your day. And towards the end, we are going to look a little deeper, and Shay will touch on some of, bring forth her knowledge on quantum biology to when we start looking at what you don't see, what's happening after a pullback injury, the fluid flow disruption. So I've let a bunch of people in. Hi, everyone. And I'm going to pull up this website, this PowerPoint. Shay, if you see any, can you let people in? I don't know if you can.
I think you have to add me as a
Is there something?
Host.
I thought you were a co-host. Anyway, if I see anyone else
Something.
in,
Um,
I'll keep. We'll share the chat monitoring
yeah, that I can do. But
slideshow.
if you add me as a co-host, I can let
Mm,
people in.
how do I do that? Oh, I can just do that on the bottom, right? Um, mm,
This is
invite.
always the fun part when you're rewatching a webinar.
I know.
First
So
10 minutes, just
we'll be
like,
fine. I'm just going to share because I'm just mindful of time and we'll just get cracking, I think.
okay.
Yeah, let me just go from there. From the beginning. Look, okay. That's Shay and I, if anyone has forgotten.
Do we
So,
need to introduce ourselves?
yeah, go on. You go first.
So my name is Shay. I work with horses. I'm a biodynamic craniosacral practitioner, and I've been doing this for almost 20 years, I guess, and certified on people. I went through a 2-year biodynamic uh, program, and I decided I'd pretty much just stick with horses because I like being outside and they just have a different tonal quality to their um, whole body that I like. I mean, I love working on people too, and I do on occasion. I also have studied quantum biology, which was more of an interest of how does this all work? Like, what is it? You know, in the biodynamic world, we talk about the fluid body a lot, and so yeah, I knew we have cellular water fluid. You know, we're 99% fluid molecularly, but I really wanted to understand that deeper, so that's why I went and studied quantum biology, and lately been studying quantum physics as well. So that's my thing. That's my story.
I love it. Well, because Shay and I are both biodynamic practitioners, and that sort of came about in Sutherland's later years. And we've always worked with fluid and light. And now, there's scientific research really showing that this is hang on, let me just let someone in. That this is the case. So, and with Shay's studies in quantum biology, she can really start to put explanation behind things and you've done some amazing posts and some great work to really provide people with information behind what's going on. And so thank you. I love it. And I've already changed my part of my life with my lighting in my house, thanks to you. I'm also a biodynamic practitioner for horses and humans. And well, my certification, my qualification is in humans. Both Shay and I did start with some equine training, and then we were like, actually, we want to go further. Um, I did start with a human clinic when I graduated, but I just really didn't like being stuck inside all day. So I have a mobile service, obviously seeing horses and their humans. Um, Shay and I both do iridology, and we collaborate with teams here in Australia and in America. When we can, we've been mapping the eye pre euthanasia photos and then mapping the eye through dissection to try and understand and make the connections really. And I think in 2022, Shay and I attended an advanced training in concussions, and that's probably what got us onto talking around. Let's talk more about the impacts of pullbacks. And I think it can't be talked about enough, really. Um, I'm still like an ongoing student for horse human trauma recovery. I feel like I'm never going to graduate that training. So I'll just take forever to get it done. but it was really just yeah, it's sort of an addition to my training in London. So that's me, and I feel extremely grateful to have pestered Shay for long enough that we eventually became friends and started collaborating together. I really value our collaborations and our friendship. So thank you for joining me, and thanks for doing this as well today. I really appreciate it.
Thanks for putting it together and asking.
No,
I appreciate it too.
no problem. And everyone's ready. So we're just gonna start from the beginning. What constitutes a pullback injury? I've got some images of methods and ways of tying horses. There's good, there's bad, and there's ugly ways. So let me just come here. So I don't know, Shay, you've trained horses for quite some time before you're doing what you're doing now. Maybe you'd like to just touch on what you did see in the practices you would do.
Yeah, so I was a trainer from like 98 was when I started training for the public full time. Um, until probably till I moved to Texas, even though I still do a little bit. I still help people out here and there. Um, and I've focused on helping people build a partnership with their horse. So I wouldn't take a horse in for training unless the owner was committed to coming as much as they could and doing, so they could understand, why I did what I did.
Mm,
And a lot of horses came in traumatized, because they'd been through, different things. And I saw a lot of horses pull back.
mm,
And that's, when I was training, it didn't feel good, but I didn't understand to the level I do now about the damage it would cause. Um, so the first thing I did with every horse was train them how to stand tied. And a lot of that was, when a horse feels that they're stuck to something, the body goes rigid and they almost, they it's like they freeze up. So I would teach them how to, when they feel that pressure, how to either come forward or step sideways.
mm,
Learning not, well, I mean, they know how to step sideways, but I would kind of cue them to, when they felt that pressure, just step their hind end over a little bit or step sideways a little bit. And that would usually give them like a release through their feet, that motion, just moving either laterally a little bit or coming forward a little bit, um, being able to know that they can move their feet would help release that tension in their body.
mm.
Um, and I had some horses that were just, it was impossible to teach them not to pull back because they were probably so damaged from
Yeah.
having, multiple pullbacks. So we would tie them high, like that first picture.
Mm,
When they're tied high, they can't really get the leverage.
mm.
But you still have to be there so they don't fall or anything. Um, I'm not a fan of hard tying, although,
Like, yeah.
sometimes it just has to be done.
Mm.
So it's so important to teach the horses. And I'm not a fan of cross ties, but
Oh yeah.
that's most of what I see. And because it's convenient for the people, but horses really get restricted when they can't,
Mm.
it's hard for them to maneuver their body around in cross ties.
Yeah.
So it is a very important thing to teach a horse to be able to tie because you never know when there's an emergency or I was on fire evacuation team, so um, good training and learning how to tie is so important. But
Mm.
there's ways you can teach them that's not traumatizing.
Yeah.
Um, you know, like I had a horse that was learned on what's called the patient pole, where they just tie them
Mm.
up in a big pile of sand in case they fall over so they don't get hurt. I guess that's what those are, patient poles. But the way they have those, it's hard for them to get leverage to really pull.
Mm.
Um, but once a horse pulls back, they we'll show you guys in a little while the anatomy under
Yeah.
their halter to so you can see what happens. So it kind of triggers them to pull back more because they when they feel that it's almost like a pain or just a automatic it's like a nervous system just reaction because they have that compression, that pressure
Mm.
and from the previous pullback.
Well, you touched on something really key is that training with them. So obviously, yes, I mean there is they do, for safety reasons do need to learn how to tie. There's good and bad ways. And if I just skip back to this where this horse is left alone on the bottom corner, um, even though they can kind of see around it, they can kind of shut down. And there's so many areas we could cover here, so we really can't cover too much. But um, if they don't perhaps have that person to cue them maybe to step forward and they pull back, um, then we've got a problem. Like you said, they freeze and we have like the fear cascade going from 0 to 100. And those downward forces you mentioned on, you get the amygdala coming online and it's like, it's panic. And now I can't get away. And now I'm really panicking. And that's when it can go really, really wrong. Right.
Yeah.
I've seen horses that have tied for ages and then one day something goes horribly wrong and they get their legs caught and they panic. So it can happen to horses that have had tying experience, that it can happen to horses where they the client's gone or the owner's gone, well, where I did tie to a piece of string but it didn't break. So sometimes those baling twines don't break. If they get a fright and they can't orient or turn their head and neck, um, who knows what's going on to say the horse is not going to go, oh, it's okay, because it might not be okay. And then we have a problem. Um, you have any other examples? But yeah, um, tying
Yeah,
fog.
that joint there uh in between the base of the skull and those first two vertebrae, that between the base of the skull and that first vertebrae, they have some lateral flexion there, and it's a way that they see their entire environment, and it's a way that they can right themselves so they can you know when they're pulling back they can't do that, so I think that adds to the
Mm,
panic as well.
yeah, absolutely. I don't know if you have this over in the States, but over here there are some breeding farms that with the young, not I don't know, it's foals sort of based on like weanling type age where they'll have halters on them and a little bit of rope. So and they'll just be in the paddock. And so they'll learn to step off of pressure. They do that so many times. And I've seen horses and I've taken the eye photos and I've seen the visible marks across the head area. Um, and the owner's gone, well, no, the horse hasn't pulled back that I know of. I said, yes, but did they have the halter on with the rope? So they're constantly grazing and stepping on it and pulling back and stepping on it and pulling up. Do you have that over there in the
Oh,
States?
yep, they do
Yeah.
that. I just saw that not too long ago in East Texas. There were these babies with halters on with ropes, and they think it's teaching them to give to pressure, but
Yeah.
it's causing, and they also tie them to donkeys here too.
Oh, great. Great. That's wild. Um, yeah. Oh,
That
everyone, if you have
wild
questions,
horses.
pop them in the chat, by the way. I meant to say that. Also, if you want to raise your hand and ask a question, please do. This is an open discussion. Um, so yeah, we're going to look at obviously force vectors, what's under the skin, and obviously, young horses that a lot of the structure isn't even developed. So hard tying young foals. I know there's a practice for certain breeds here where they just hard tie them, and I think it's a Highland pony breed, and they sort of think the horse is okay. They're big, heavy breeds. They don't do much, but they pull back. And um, there's a lot to be said about just leaving a horse just alone with nothing and getting them just to stand there, because obviously they will shut down to try. They just kind of go inside. But if they get a fright, and I feel like internally it must cause them a lot of stress. Would you agree, Shay? Just being stuck there and tied.
Yes, and any trauma, whether it's emotional or physical, is the same. It's
Mm,
the same in it goes through the autonomic nervous system, and according to the nervous system, it's all the same. And
yeah,
and then when that kind of stuff sets in, it creates a higher level of heteroplasmy, or a low redox state. So that trauma, whether physical, emotional,
mm,
it gets set into the fluid matrix, and it starts to break down mitochondrial function.
yeah.
So we can get in more in that when we start to get into the
I
anatomy.
love it. I love it that you dropped mitochondria in the first 10 minutes. I love that.
Couldn't help myself.
Do it.
I was laying today, I was laying on that chiropractor was doing the matrix repatterning. I was laying there, I was looking at the wall. I was like, is that a picture of a mitochondria? He had one. He had a picture of a mitochondria. So I
Are you
thought that was
serious?
cool.
You're gonna see it. You're gonna see it everywhere. It's like I see embryos everywhere. You see mitochondria everywhere.
Hmm.
Right. Let me just see what's happened here. Okay. So if we look at these photos here, particularly, let's say the top right and the bottom left, we're looking at these are horses that, they're in the they're getting out. They're trying to, it's fight, flight, or die. That's the situation they're in. There isn't a kind of, oh, I'm going to stop and come back now. It's gone beyond that, and they are going to do whatever they need to get away if it means breaking their own necks. So that's, and of course, what we've got now is the panic and flee button being pressed, but there's also a massive handbrake button on at the same time, and that's the rope that's not breaking. Um, the horse isn't
And
able to
that
get away. Sorry, go on.
the picture on the top right
Yes.
is a good demonstration of how a force vector travels through the body. So you
Yeah.
can see that the pullback is
Yeah.
affecting the base of the neck and the hind end
Yeah.
and the jaw, of
Exactly.
course. But
And the jaw, everything. And
yeah.
actually, the ones on the bottom right and the bottom left, you can see how they're twisting as well.
Mm.
And that's when you get that real twist through the neck, down through the shoulders, through the withers, and everything like that. Um, so there's an enormous amount of stress that then gets left in the body because they haven't been able to get away. Um, And so a while ago, I don't know if anyone has seen Shay's fantastic post on pullbacks. This webinar has pulled a few little nuggets from that post, and we're going to talk about one of this area here where my cursor is gets quite affected during pullbacks. Oh, and tight bridles and all sorts of things, but just a close up here. So if we go back to say that photo, top right, see how the pressure's there? Pressure's here. The temporal bone and the occipital mastoid suture. These are very movable, and there's a lot going on there, isn't there, Shay?
Yeah, I have a skull that was he'd only been uh not alive
Mm,
for 2 weeks, and she put him in a pile of ants, so they, cleaned it up pretty well. But
mm.
that petrosal bone, I could clearly move it.
Yeah.
And it's yeah, and you can see I have my skull.
So right here, where you see the red square, everyone, right here. This is where the ear is coming out. This is the ear canal, audit, okay? This bone. We've got the
Yeah.
inside there will be the labyrinth, the vestibular-coccygeal nerve, which is the eighth cranial nerve. A lot of blood supply. Yeah,
The hyoid comes up and attaches to the base of that little bone.
just there. Yep.
This
Just
is,
back
here's
here.
another
Yeah,
view.
where's
I
the
don't know
skull?
if people can see this. So here's the whole skull. Like here's the eye. Here's the ridge. You see when you look at them head on, you see this protrusion on either side. It's right
Hmm.
behind that bone. It's
Yeah,
right there.
right there.
Yeah. I don't know if you can see that. So
Yep,
it's
that's right there.
this whole piece, and then how it joins to this as
Yeah,
well.
that's the
All that,
occipital mastoid suture.
yeah, all that is ooh, all that is very vulnerable. It's not an
Yes.
area you want any pressure on, much less a pullback pressure.
Yeah, massive forces. So that's a close up for you guys to have a look what's under there. So just to orient you, just as Shay did with the skull, that's basically there's the parietal, temporal parietal. So that's the nuchal crest there. That's the occipital condyles there. And obviously the spinal cord comes out here and C1 attaches there. There's an awful lot going on there. And we, yeah, put a halter on and add a pullback. Um, Here's another picture of it. So I put this slide up around sutures and cranial bone movement because we often think of bone as kind of dry and hard, a bit like these pictures here. I just want to thank Maggie Ashley for permission to use these images. Um, and obviously, this is living tissue with blood supply and nerve and fascia, periosteum, inside and outside. Um, and the bones are designed to move very slightly within this suture and in motion. And if there's an excessive forces, they can get jammed up. They can get really stuck. The periosteum that lines the inside of the skull is continuous and weaves inside and through those sutures to the outside on the periosteum of the outer part of the skull. So yeah, if you get an impact, put that force pulling down, say on the back of the neck, like that, all of those forces are going to pull those bones on the face and the head and the neck. Do you want to comment at all, Shay?
Yeah, I had that skull that I had. Um, he actually had where the frontal and nasal bone meet, like right here.
Yeah.
This whole side was had been it's like it compressed together and bulged out
Wow.
from one of these.
Yeah. I mean, William Sutherland, who was sort of the father of cranial osteopathy, like craniosacral therapy. Throughout life, these sutures are designed to breathe and move. They don't fuse up and ossify with age. The only time they will ossify is if there's been a pathological trauma or severe forces.
Yeah,
And
that
that,
you
yeah,
hear we hear things like, oh, the frontal bone completely fuses at, age whatever, but it doesn't actually completely fuse and become one bone.
no,
It always has those sutures, and in within those sutures, within those little pieces where it's
mm,
all connected, has nerve, tissue, collagen. It's a live tissue in there. So um, they always are movable unless, there's an injury. But when you
yeah,
hear, oh, the suture on this bone fuses and that bone fuses, the word fuses does not mean it becomes one solid piece of bone.
yeah. Thank you. That's really, I'm glad you clarified that because, yeah, it can be really misleading, I think. Um,
Yeah.
so just to show, we've got Shay's photos here, just to show that the bones are living tissue and they can move and change. So let's just say a horse A has had a nasty, nasty pullback. Um, what we might see in a horse that's had a pullback is a real strained appearance across the face, often dry, um, often wrinkles above the eye. Um, maybe then the eyes aren't fully open as well. I'm just going to let someone in. So, Shay, you want to talk to us about the photos on the left and the right? So, what do you know? These are your class photos. What do you know about each horse? Did they have head injuries that you know
Um, well, these were what I loved about these photos is this was from the first class I taught there, from people learning how to do craniosacral.
of?
And you
Exactly.
could see that's what I love about
Mm-hmm.
these pictures. And their history is unknown. They're donated horses. Horses that get donated are usually pretty broken. Um,
Yeah.
they the kind of things that we might look for are how well are their eyes moving laterally. Are they tracking, or do their eyes kind of do that skipping motion, or are they not even able to track and start twisting their head? The posture dynamics, although, when you pull a horse out and they just stop naturally, people don't always pay attention that they're stopped with like the neck jammed down into their shoulders or the back
Mm-hmm.
drop.
Mm-hmm.
It's usually not until after we do the this work and do photos and you can see the
Yeah.
change, that you see how dysfunctional they were to begin with. Um, so these horses uh, were literally treated, like worked on for 4 days with people learning, and you can see how much it looks like just fluid came back to the tissues. That's the
Absolutely.
biggest thing I see. Um, their face shape can literally change as this fluid is restored. Um, you can see that their eyes will level out,
Yeah.
and there'll just be a
But
softer appearance. You might see more definition of their bones, and
yeah, the nostrils change. They go from that kind of pulled look, and I love it. This is your level one class, and not to plug both of our trainings, but so much. I mean, I taught a level one in South Africa this year, and the changes just from like 4 days of people just learning basic contacts and being present, you know, in the as the body feels safe and there's a soft attention on it, and we orient to the health and the fluids, it can find restoration. That's how intelligent the body is, right?
yeah,
Yeah.
yeah. Dawn said their coat coloring seems to have changed, and
Yeah.
that's a huge thing that you'll see. The coat, I've seen the coat actually go from kind of a pale, bleached out look to a vibrant, rich
It's
color, and
amazing.
it still amazes me.
Yeah. Oh, hang on, I skipped it. So let me just, did I skip one? What happened there? There we go. Um, I just popped this in. This is the underside of the skull again. Um, because Shay touched on when you're looking at a horse that may have had a head injury and you start to pay more attention, looking at the eyes and the head position perhaps, and just the basic look on the face. If we look at the underside, this image on the left is a foal skull, and the image on the right is a horse that's I think about 5 to 7. But this whole area, the basi-occiput and the basisphenoid, okay, isn't osseous yet until probably around 1.5, 2 years old, I think. I mean, at a guess.
I think even
Mm, maybe two and
I
a half.
have a skull that's probably, I think a dentist told me the skull was probably 18 months.
Yeah, wow.
It also is
Mm,
missing that. So it's pretty soft.
very. There's a lot of important things here. So if we look at, say, restriction in eye movement and head movement underneath. So this is looking at the skull underneath. The spinal cord comes out here, these occipital condyles, and they come down here and meet what would be a what we call a synchondrosis joint, which is where the occiput and the sphenoid meet, as they used to be vertebrae, and it comes down here, and the sphenoid on the horse forms the rear socket of the eye like that. So if there's force vectors there pulling on the tissue and on the many cranial nerves that traverse through the eye, which there's five, I want to say. There's part of the trigeminal, four eye cranial nerves. That's going to pull on eye movement. So we've got to think, this is living tissue, not bone. It's being forced and it cannot come back. Um, and we'll talk about these little areas later on, these two holes later on, when we talk about fluid flow disruption. Is there anything else you want to add to that one?
No, no, that was good. It's just, I just want to emphasize
Mm,
young horses when they pull back.
mm.
That's, I think, even more tragic than an older horse. Not that you want it any time, but when those bones are soft.
Oh, yeah. And the thing is, if they've had a nasty pullback, they're going to be very adverse to certainly being touched around the head and being tied. And I did want to touch on, I forgot, was that some people, I mean, see it as a behavioral problem and bad manners. I mean, I think it's a very small population that now, but that's not the case. This is, it's as if a person has had severe whiplash, um, and they get very sensitive around the back of the neck. I actually spoke to a client who got impacted by a car rear-ending her, and then she was terrified of driving after that, of cars behind her. So if you think of a horse that's had a nasty pullback, they're going to be pretty scared about being not tied and not being able to get away again. It is, it's not a nice experience. And if it happens at a very young age, um, people go, he just won't tie up. He's just getting away with it and he's naughty and blah blah. I don't think that's the case. It's
Yeah, I've known quite a few horses, especially horses off the track, who get pretty nervous about ropes and
yeah,
tying.
yeah, yeah,
So Kate asked, so the sphenoid is not a solid bone until 18 months or so.
yeah.
Yeah, it's like it's all this occiput where it meets the sphenoid. That whole area is pretty um soft.
I mean, our colleagues in over here who've dissected foals, the sphenoid, once they process the bones, is in parts. I mean, it's in many parts. It's got a body. It's got two wings at the top, two wings at the bottom. So that can get really nasty torsional forces, which obviously will affect eye movement, but also the psychology and cognition, because it's such a central bone to the head, isn't it?
Mm-hmm.
Mm. So this is a photo of Shay's, which is a lovely image of how you can, yeah, you might want to talk us through this, Shay. See how this horse is kind of looking down, trying to orient.
Yeah, the horse on the left, these are two different horses. The horse on the left had no lateral movement of his eye. So see, I was just offering that he um, bring his head around to the left and look. I think I
Mm,
even had a treat or something to spark his interest. Because sometimes when you put pressure to ask the horse to come around, they're so used to bracing against pressure that they'll they'll brace the other direction and they'll try to look the other direction to get away.
Yeah.
Wherever a horse is looking is where they're thinking. So I was trying to get him to think and look towards me, and he couldn't. He couldn't move his eye. His eyes couldn't come around. He also
Mm.
had some pretty nasty hooks on his incisors.
Yeah.
You know, those the last incisor when they get those hooks. And he was a dressage horse, and they complained that he was fussy when they put him in a frame.
Mm.
But his jaw literally could not slide back and forth.
That's a whole other webinar,
In
isn't
the
it, on
street, yeah,
dentistry?
that's a whole nother thing. Yeah. Um, but he yeah, had lost all lateral motion in his eyes. I watched him for a while, and I never saw his eyes move.
Yeah. And he
And
was
then
written
this,
in a fixed position as well, right?
yeah.
Like
Oh,
that. Yeah. Well,
yeah.
that's going to affect.
Yeah, so imagine being in that frame and not being able to move your eyes.
Mm. So I
Um,
know everyone on this call is going to start looking at eye movement now in horses, if they aren't
yeah.
already.
Yeah.
But it's good.
It's a good,
You will probably see it, but the more you go, oh my God, I have seen that skipping that you talk about, and for a horse not being able to orient because of the way their neck is also developed, the whole thing, and the eyes and the neck are deeply interrelated. They can't orient. They don't feel safe. They will be a bit spooky, or they will be quite shut down. Um, there can be a number of things, right? I mean,
yeah. There
yeah,
was a horse. I think I wrote a post about this horse because it was so profound. He had he went to the vet for something,
yeah.
and he came back to the owner blind, and they were pretty vague about his accident, but they did say he pulled back and fell over, and the vet said
Wow.
he injured his eye nerve. That's what the vet said. And you can also take your fingers and like go up to their eye and just kind of flick and
Hmm.
see if their eyes blink, like if they. So I did that on both sides, and one side nothing.
Mm.
And he did get I gave him a cranial, and after that his eye was blinking when I did that. But his whole behavior was so cute, changed, and he was looking around, and we turned him out, and it was like 110 degrees. It was a really hot day, and he was like blasting and whinnying in the
Oh,
pasture.
wow.
It was really cute. But yeah, he got his vision back. And she said he's
Oh,
totally fine now.
that's so
Um,
cool.
uh,
I mean, I
somebody
love
asked,
that story. Yeah.
someone asked if can be- can being tied in trailer float travel cause unknown pullbacks? Do they really need to be tied in the trailer? Yeah, they can
Yeah.
pull back in the trailer. They don't really have the same space unless um, it's a huge open trailer. But yeah, and tying them up, I think that's a horse preference because I've had horses where we left them untied, we had to pull over and tie them because they were just too, you know, moving around.
Mm.
It was dangerous. So
Yeah.
usually I tie them, but I never, ever, ever. This was something I taught the evac team when
Mm.
you're loading horses you don't know, or even horses you know, never,
Mm.
ever open the back until they're untied.
Absolutely. Because that's when I have seen some nasty incidents.
Yeah.
And
You're just asking for a wreck.
yeah. And if you do have a float that is on the small side, you have a big horse, sort of I mean, I think more people are like finding out to perhaps move the dividers so that they have space to, because for a horse, they need to be able to spread their legs to balance. But
Mhm.
I think you're right. The accidents I've seen or heard of are when the horse hasn't been untied properly and the back gets let down, and then they just want to get
Yeah.
off. I just popped this picture up here because again, this shows the head and neck restriction on the left. That was as much as he could. You see how he's forward of the shoulder here,
Yeah.
and as he's turning to face me as I'm taking a photo, that eye starts to close.
Oh, yeah. I've seen that
Yeah,
where they
and he's
start to close their eye when they
they're like,
turn.
ow, and so this is all jammed up here. And then afterwards, he just turned to face me again, and he's completely aligned here, and he's just like, oh my God, I can turn my head. So, and he definitely had pullbacks, and he was just hammered, like as a kind of in his past life as a trail horse or jumping or something. So,
Yeah, and that's something that people aren't going to notice. In
no,
general, I don't mean to be down on people, but I go to a lot of barns and I see things like this, and
mm,
they won't the trainer won't notice like this this picture on the left, but they'll notice like, oh, he's not picking up, this lead, or he's not able
uh-huh,
to do whatever transition, or
yeah. Well, what's
when
interesting is the mum of this daughter's horse said, I actually used to think he was quite a pushy horse, but now I've realized since that he actually had a headache. And I relate to that because that's what got me into this work. I couldn't, and the horses pushing and being fussy with their heads. And then I realized, well, actually, when I started studying craniosacral, maybe they had a headache or they had neck ache or they couldn't see properly. And it was deemed a
yeah, I've
behavior problem.
I've seen that too, the pushiness, the unable to load, the
Mm.
horses having a hard time loading, um yeah, all kinds of problems that would people might send the horse to the trainer to fix when they just need their head addressed.
Yeah, they just got a horrible headache. Um,
Yeah.
Again, these photos are courtesy of Maggie Ashley. Thank you. So she's the premature foal here. So again, just so you can see, this is a great photo of the sphenoid here. You see, someone was asking about it. See
Mm-hmm.
how it's
Okay.
very much in parts here, but obviously, it would be beautiful and cartilaginous but yeah, this was a premature foal. Because you popped at something I might have been on your private group, Shea, about someone whose foal had some C1, C2 compression or tension and was struggling to graze.
Yeah, so this is a friend of mine who went through um a lot of the same training that I went through with the cranial work, and she had a mare that just had a colt, and she said the birthing process was difficult. The mare got up and down like 4 times.
Mm,
And she noticed when the foal grazed, he had his, instead of his legs splayed out evenly, he had one foot forward and one foot back. And
yeah.
she had remembered that uh, Carrie Ridgway had done a lecture, the late Carrie Ridgway, a lecture years ago about high-low syndrome in hooves and how it starts from a birthing trauma at either C1, C2, or at the withers, and to get a chiropractor out ASAP. So she thought, well, I'll just do cranial on him. When
Mm.
she saw that, she thought, oh, he must have had a birthing trauma. Plus, she was there during the birth. And so she did some contacts on C1, C2, and she said he just melted and passed out and fell asleep.
It's so
And
cute.
I know, the video is so cute.
It's little foal like fast asleep.
So cute. And the next time she saw him grazing, he had his legs splayed out evenly.
Mm,
And then, so Carrie Ridgway said they should either be splayed out evenly or crouched. So,
mm,
and she sent me 2 pictures. One, he was splayed out evenly, and the other one, he was crouching, so their front legs, they actually kind of bend at the knee, but their feet are even on the ground. They're not,
Doing
one
that.
foot front, one foot behind.
Yeah.
And she's
Yeah.
been doing some contacts like once a week or so. She'll just go do one contact, and every time he passes out. And the mother is also um, has a lot of pelvis distortions from the birth too. So
I
she
mean,
lucky foal that has her working on him.
I love that. And the thing is, we wanted to pop this in here because, if there has been birth compression and it's not addressed, so, then there will obviously be some sensitivity around the area when you do get to maybe getting around, putting a halter on, or teaching the horse to lead, not even get to tying. So never ignore and always acknowledge birth as a very forceful. It can be quite, often horses' births are very fast, and that's when those fast compressive forces can affect the head and the neck. And if the mare's pelvis is distorted, which often it doesn't really get looked at right, then that will also affect the birth, just in this case. So I really appreciate you sharing that story. I mean, we should have popped the video up. That was so cute.
It was so cute. Yeah, I forgot to ask her if I could have permission to share that. Um, and I thought that was interesting about the high-low hoof.
Yes.
But you always hear people say, "Oh, it starts when they're foals and they put one foot out front, one foot in the back." But
Mm,
I don't think it's well known that it's can stem from a birthing trauma and that can be fixed if
mm.
it's addressed right away.
Yeah, I mean, I'll fully admit, I was like, I used to think that, it was to do with perhaps something going on just with ribs and sternum, but really, because the neck's still quite short when they're so young, they need to graze, like you say, out or bending. And the grazing acts on the nuchal ligament, which then also starts to change the shape of the nuchal crest. Because obviously, when they're born, it's just a little kind of flat surface. And that's we need to do a whole other webinar on foaling. Uh,
Yeah, because they raise them now in, not natural environments.
yeah, that's right. And they tend to breed for long legs. And yeah, I just popped this one up here. This guy, he looks extremely young. He was probably 1.5 in the left photo and was hard tied
Mm.
as a young foal. And that's what he looked like. He could not put on weight. Yeah. And so I done probably 2 sessions by August, and he started to grow again. So that impact on even the pituitary gland and the deep structures of the brain will affect growth if they've had torsional forces to the head. That's my clinical opinion, just backing rather than has it been investigated scientifically? Not yet, probably.
Yeah, other than the iridology and
Mm. All right, folks, let's look further. We're just going to take you through some anatomy. So if we look at, obviously, we know there's nerves under the skin, and just dropping a little nugget of, if people look at head shaking, can be allergies or wind or sun. If those bones are compressed, then the nerves and the fascia, particularly the fascia around the nerves, will start to get compressed, and then you might start seeing head shaking.
yeah,
That's like a nugget.
yeah, the the little hole in the skull that the nerves come out of are called foramen.
Yeah, I'm
And
just holding
those
it away.
those little holes, if there's any distortion in the cranial bones, uh, or any tension in the fascia, that's going to put pressure on the nerve.
Thank you, Shea. Yeah. See how this massive nerve here, that's the second branch of the trigeminal nerve, that's the maxillary, tends to get pointed out as the one that causes head shaking. But let's look at all of these. Guess what? They all work together and they function in motor and sensory cascades. But if there's been a torsional force, as we've shown you, affecting that pull around the eyes, through here. There's a lot going through here. And here's that occipital mastoid suture. Here's the petrous portion of the temporal bone. Look at what's coming out here. Is it a wonder then that head shaking could occur? It tends to happen as a bit of a tipping point. And I've certainly seen horses that have had severe pullbacks start to present with head shaking. Have you?
Yeah, severe
Yeah.
pullbacks or bad dentistry.
Yeah, yeah. And I realize head shaking can be a comorbid issue as well. There can be gut problems and so on and so forth. But from a craniosacral lens, we are going to look at how can we help restrictions in the body function in a better way so the body can start to find fluid flow again. This is courtesy of Terza Hendricks. Thank you, Terza, for permission to share this. So she's an expert at just dissecting out the cranial nerves. But just so you can see, there's a lot under the skin here. She did ask me to try and name these. It's actually quite tricky because obviously a dissected horse will look very different to the books. But right here is the hyoid. Okay, that's the styloid bone of the hyoid coming down. There is the tongue, part of the tongue. Here's that ear, and there's that petrosal portion of the temporal bone right there. Okay, and here we have, obviously, that's where you could have torsional forces from the pullbacks. And this is the vagus coming down here, down the neck. I know in that post you wrote, Shea, those downward pressures put a huge force onto the nervous system, doesn't it? The autonomic starts to get dysregulated.
Yeah, and what does the vagus nerve control? I mean, it goes all the way down, but it controls the top part of the gut.
Mm-hmm. Yeah, exactly.
And then it communicates to the enteric nervous system, which controls the lower part of the gut.
Yeah, yeah. And it's 80%, is it 80% of its fibers are parasympathetic. So it really is, it helps the body stay in a kind of homeostatic space. I mean, it's such a big conversation, the vagus nerve. So to try and like simplify it is that for me, keeps an eye on all the other nerves and the blood supply. It also talks to the vascular supply and will apply vasoconstriction can occur when the vagus is like, quick, okay, it's time to run. It's time to get out of here. So if that horse has had a pullback, hasn't been able to get away, everything is still in a vasoconstricted state and everything's in a sympathetic state. And that's exactly what Shea was talking about with posture. An inability to regulate or rest properly can occur.
Yeah, that was a good point. And the brainstem also on the horse is of course you can't see my cursor.
No, where do you want me to go? Like up here. It's up here, isn't it?
Where's your cursor?
Can you see my cursor?
I
There.
could. Oh, there it is. Yep.
There it is. So if I
Yeah.
kind of come up towards here and back there, I mean, I
Yeah.
often will feel shock through the brainstem, right?
Yeah. The brainstem is, protrudes out a little bit. So that's going to get pressure on a pullback. And then that can affect things like the ability to swallow, among all
Yes.
kinds of other things.
That's a really good point. That downward force is on those deep protected brain structures. That's the autonomics, isn't it? That's swallow. So we've got the endocrine, the sleep wake cycles, the body temperature, hunger, thirst, breathing, digestion, blood pressure, you name it. I've actually got a good dissection photo of that. So let me just let Sam in. I just put this photo at the bottom here so you could see where that's there. Enormous force is so much that the horse is nearly sitting on his haunches. In severe pullback or head impacts, I've seen this nuchal ligament rupture a bit and pull off a bit of the nuchal crest. That is extremely painful. And really shockwave has been the thing that's helped that pain go. But I can't imagine them. Yeah, it would be very painful. But as you can see, if we've taken all the superficial, middle, and deep, leaving on the deep layer muscles here in this dissection photo, there's your neck. And there's the neck. So just so you can see what's underneath. Feel free to add anything to that, Shay, with the
Did we talk about a little bit about the myodural bridge?
no, we didn't. So go for it. I don't know if I've got a photo. No, I haven't. Yeah, but it's up here.
Yeah, so that's basically the muscle. So in a horse and in people, there's some areas of the spine where the spinal cord is not fully protected by bone.
Mm,
So there's like little openings,
like this
and
bit
there's
here.
a big one up, yeah, like between C1 and C2, there's a big opening. And there's direct muscle attachments to the spinal cord from the muscles you can see on their neck.
Yeah.
There's also
I just
have,
put that there. You see that?
yeah, you can see
Yeah.
that little, see that hole, that opening.
Yep.
So when there's muscle tension there from either pullback, or I also see damage from overflexing when they
Mm,
ride and they're overflexed, and
mm,
that area gets really tight and the nuchal ligament gets actually stretched.
yeah. Yeah.
That's
And that's
all pulling
yeah.
on the dura, the spinal cord. And I think it was in Indy and their dissection
Hmm.
Patreon. If anybody's interested in that, it's really good. It's called uh,
I'll put it in the chat.
Bones, Brains, and Behaviors.
Yep. Bones, brains, bodies, and behaviors. These are
And she's got a really good picture. I think it was that one. I also subscribe to Ivana
mm,
Ruddick's. And then
equine
Beck
anatomy.
Nairn has a good one too. But I think it was Indies where they had you could actually see inflamed nerves. Yeah, Equine Anatomy and Layers is Ivana. Um, where they had all around that spinal cord were inflamed nerves. And was that horse a head shaker? I kind of
I can't
remember.
remember. No, I can't remember. But you've actually just beautifully led us into the next slide. So we can see
Oh,
the dura. Okay, so this one on the left was actually a Gillian Higgins dissection I went to. So this dura is continuous. And there isn't one part where it stops. So it's obviously covering the brain. It's continuous inside the skull, continuous through the sutures of the skull to the outside of the skull. Just so you guys can get, if there's a force vector on one area, it will pull and cause other areas to then pull. So the one on the left is the dura mater, meaning the tough mother. The one on the right, this was a dissection I did with Evan Indy. So here's the dura. You can see my cursor here. That's the tough mother. This is the arachnoid mater, the spider-like mother. And where I've got my tweezers, that's the spinal cord, and surrounding that is the pia mater, meaning the delicate mother. This is a really important structure, the meninges, the mothers. Look after your mothers. So yeah, Shay was talking about that torsion on that C1, C2. You get a pullback, it's like basically the dura locks down onto that spinal cord and leaves it in a very sympathetic state. And there's got to be fluid restriction there. Okay, it's like having the brakes and the accelerator slapped on at the same time in a car. And yeah, so the cerebral spinal fluid flows through this beautiful area. And not just it's not just confined to the spinal cord and the brain. It does exit out of nerve root foramina through the spinal vertebrae, and it has the same consistency as the ground substance of fascia. So we talked about coat color change. It's when there is what we call an ignition and an interchange in the fluids that's systemic. Once that cerebral spinal fluid and the fascia gets the light, like the light gets switched on, doesn't it? Or it gets, and it's a systemic thing. Yeah, so that's so you can see we've gone from skull to muscle now down to why we're seeing, you know, problems at the deep brain level. Here's another one. This is a dissection I did with Maggie. So Shea was talking about the brainstem. That's here. This is the cerebellum. Here's the brains, and that's the spinal cord coming out there as well. So that cerebellum will be sitting in this little house here, right? And you get a pullback. So back here is like the nuchal crest. And here's the front part of the skull where the cerebrum would sit. I don't know how to get rid of that annotation. Anyway, there's a little map here of a country that I drew.
Or a sheep.
Yeah, oh, right. Yeah, cool. But I like this picture because you can see the vascular flow that is everywhere and the nerve roots here. Okay. So it's just, again, to get a visual just of what you were saying, Shay, that there can be a lot of shock that gets left in the fluids from a pullback or a head trauma, right?
Yeah. Yeah. The fluids, if you notice, everything in dissection photos is juicy. And one of my mentors, Dr. Sarah Pugh, she always says, without water, we would just be a pile of dust.
Yeah.
And this cellular water and this water that covers every hydrophilic surface has its own intelligence. That's more of the quantum body stuff.
But look at the slide. You just led us basically into the next slide. Look.
Oh.
Fluid flow matters, you know, and I've taken that from Adrian Larkin's talk on YouTube on the effects of concussions. Fluid flow matters. So this is where we see, you know, a horse has had a pullback, I don't know, years ago, or they don't pull back now, but it was never addressed. And so what we tend to see is restriction in fluid flow. We might see inflammation in the body, laminitis, skin problems, obviously cognition, breathing, can be all sorts of things. So let's not forget there's a blood supply along with each nerve. And I'm going to take you through some slides, and then I'm inviting Shay to talk to us a little bit about what's happening at a deeper level. So if we go back to the embryology, because of course that's one of my favorite topics, when the embryo is forming, the nerves and the blood, so let's say the blood is coming online first, and the nerves. So the nerves and the blood supply anchor the growing embryo, and they are there before the bone is formed, just so you know. So they are there first. They are first and foremost. Dr. Sutherland would, no, Dr. Still, the founder of osteopathy, would say, the rule of the artery is supreme, but the cerebral spinal fluid is in command. So the fluid flow is extremely important in osteopathic work, is extremely important in Shea and my work, is how can we get those rivers flowing again? So let's look at the jugular foramen. I don't know if you'd like to take us through what comes out of the jugular foramen and the foramen lacerum, Shea. That's here. just there. And then we've got here.
Yeah, those the cranial nerves, the vagus nerve
Yeah.
comes out of the jugular foramen, the jugular, the exit for um, the venous sinuses.
Yep.
Do we have a picture of the venous?
I think oh, I don't have a picture of the venous sinuses, but I've got the brain picture which showing the vascular flow. But yeah, so again, so look, we've taken you through torsional forces on the head that can affect eye movement. But look at these tiny holes. Like if there's pull on there, right, we're going to have um, vascular restriction.
Yeah, next, so that go back to that one,
Yeah,
the petrosal bone.
yeah,
Remember that one from the very beginning. That's the one that moves
yeah,
because their ears move and the hyoid moves. So that bone, and because, that's where the ear canal comes out of and the hyoid bone attaches to, and it has to move. And then
yeah.
it's got these little holes in between the petrosal and the occiput there, where some very important nerves and blood supply come through.
Yeah.
And
So
that, if that gets restricted, then it's there's all kinds of knock-on effects from the brain not being able to uh, detox,
yeah. And
and the vagus nerve signaling.
what would we usually see when that's restricted? I tend to see that kind of puffy, foggy head look in the horse. They kind of look like they've always got that kind of fogginess going on. Um,
Like those
congestion.
camp horses in the beginning,
Yeah,
they
exactly.
had that look.
Yeah. So no drainage, no proper venous drainage. And I haven't got the image here, but you can see it probably on one of our webinars that you can get on Shea's website, where they did do a study with humans, where they did a human with a mild concussion and a test subject, and they did MRIs. And basically, the veins that come out of here, which are the internal carotids that drain back down to the heart, they couldn't be seen in the person. 6 months later, they were not. You couldn't see them in the person that had the mild concussion. Okay, which and that's proof in itself. And this little area here tries to take over with the other veins, but it's really important because the clearing that the cerebral spinal fluid does and the blood needs to drain out, doesn't it? If it can't do that, we can have neurodegeneration.
Yeah.
Yeah. So yeah, this is just some images of the horse brain left and right. So this is surrounded by cerebral spinal fluid. This is where Shea was talking about. There's that cerebellum and that brainstem. Imagine a downward force here, right? That's going to affect to that level.
Yeah, and there's muscle and bone protecting it, but that force, the force of those pullbacks is like, imagine getting rear-ended in a 1950s car that has no headrest.
Yeah, yeah, pretty bad.
Yeah.
Here's your cerebrovascular supply.
Oh,
Okay,
there's the venous sinuses.
here we go. So there's blood flow going all the way into the brain. That pia, that delicate mother, before I'm going to shut up in a minute and let Shay talk about what's going on at the mitochondrial level. But that pia mater, which is that delicate mother surrounding the spinal cord, basically has openings that feed cerebral spinal fluid deep into the brain and a vascular flow. Just remember, with even if we can't see it, there is a vascular supply with the nervous supply. Okay. Um, Otherwise, there would be no living tissue. But like you said, that the fluid is what provides life. It is life. And you can see it going all the way to the deep brain. Okay, here are these venous sinuses coming out of the jugular foramen. See that down there? There are massive veins here. This is the vein of Garland. It sounds like something out of Lord of the Rings. But yeah, an impact can actually restrict that foramen, and it can restrict the drainage of here and go that will exit down through there, down back to the heart. So let's just say, Shay, the horse has had a pullback. It hasn't been addressed. We've definitely got congestion going on. What's happening at a deeper level to the blood flow and the fluid flow up here?
Well, if you think about the fluid body, meaning cellular water, um, even blood is 93% water. And then if you look at this water as I'm trying to think of how to put all this quickly and simply. The water inside of us runs on a DC electric current.
Mm,
And this water has to be in a structured state. So if you think about a water molecule is hydrogen and an oxygen and two hydrogens, and it's in a triangle. Remember those from biology. They're in a triangle shape,
yeah.
and they have a positive and a negative side, and then they cling to each other, and and when it's in a structured state, it forms geometric patterns, the water inside of us, and it's also electrically charged. So we also um, make light inside of us, and that light and that water have a relationship. And
Mm,
when this water has to be in a coherent, structured state, and
mm,
that's the quantum signaling. That's the bioelectric signaling in our body, which happens faster than biochemistry. Our entire medical world goes off of biochemistry, and bioelectricity has not really been part of any healthcare system of animals or people.
I have a quick question. So, just for these guys and also my own interest. So, if I'm looking at, a concussion effect, so a pullback in a horse, and we've now got the brain is trying to rewire and get back online. It's obviously in a state. There's a fluid flow disruption happening, and what is happening to the coherent structure of the water and the fluid at that point when it's had a trauma like that?
Yeah, so any trauma to the fluids, whether it's from a pullback, whether it's toxins exposure, it causes it to lose its coherence. It destructures, and incoherent, destructured water is the same as like inflammation.
Mm,
And this water, so Dr. Gerald Pollack was the one that did all the studies on what's called exclusion zone water. And
mm,
it's called that because our mitochondria make cellular water in step 4 of the electron transport chain if it's getting the correct signaling. That's why we have to learn how to take care of our mitochondria. Otherwise, we get cellular dehydration, and mitochondrial dysfunction is like the the um, is what causes all diseases. So then it makes the water, and then when the water touches a hydrophilic surface, it becomes exclusion zone water. So it's a gel, it's like a water that's in a gel state. when it's coherent and when it's in a structured, coherent state. When there's a trauma, and even I'll even go down to the the blood supply. So the veins, the vascular supply
Mm,
is sorry, my distract. If you look at a blood flow and like Doppler imaging or whatever, you see the lining of the vein and then the blood, and there's a space between it. And that space is called glycocalyx, which is exclusion zone water. So it's called exclusion zone because when it's in a structured state, it excludes things to penetrate. So it protects whatever it's a surface of. It's protecting that. But it's smart. It has its own intelligence. And there's a signaling when something in the body needs something, that exclusion, that gel like water will turn liquidy and let something pass through.
mm,
And then it'll form back up to gel. When it's destructured, it's always liquid. So
yeah,
things pass through it, like larger proteins that can pass through and like penetrate the vascular wall. And that's when you get like plaque buildup or whatever. So
perfect. That's when we get these beautiful images.
yeah, yeah. So there's like nice structured water. So that's what's happening in a pullback is it's
Mm,
causing an injury, and when the water loses that structure, it also loses its ability to communicate down the line to other
mm,
parts of the body. Even like
yeah,
the when Emma was talking about the embryo, the brain and the skin have the same tissue in embryo.
that's it.
So in the adult body, the brain, the gut, the skin is all the same. So problem in the brain is going to be a problem in the gut and a problem in the skin.
Yeah, yeah. And like our body is an ecosystem, and where there's stagnation in an area, if it's not addressed, the surrounding environment will start to lose function. And what you'll find is a buildup or a prevalence of other species or bacteria. And then, but what I found is if you're able to clear the river and clean up the ecosystem, the fluid flows again, just like what we would do as practitioners, is that we are allowing the fluid flow to happen again through orienting to that potential for health in the body, right? For orienting to the light and the fluid in the body. And I love that explanation of what's happening at a really deep mitochondrial level, Shea. Thank you. Is that structured water, whether it be cerebral spinal fluid, blood, plasma, it's so important, isn't it? It's so important to have that.
Yes. And I think it's the most important aspect of our biology, our physiology.
Yeah.
And it's just not really, and there's so many things that are affecting it these days with the EMFs and all that. Do you
And no, go on. What were you going to say?
do you have anything to say? I mean, once we finish this topic about what you're seeing in iridology with the dissections and the head trauma markers.
That's a really good question. With iridology, I feel like we're just barely touching the surface. And I think this year and next year, I want to look further into what we can do with regards to biopsy. Basically, I mean, Shay and I are always looking at it from a whole perspective. Um, what we found with iridology is the markers are accurate. What we don't know is the severity. We can guarantee if there's a gut problem, there will be inflammation in the head. That's what we can see in iridology. If there's a head trauma, there will be problems in the gut. Where it gets complicated with horses is that often their gut might not be very good anyway, because we don't know their domestic situation, we don't know the feed, and we don't know the gut biome. But I feel like there is definitely a place. There needs to be a place for the quantum biology lens to be put into iridology. Absolutely. What we
Yeah,
need
because
is, yeah.
what I see is so much of this stuff is from a low redox state or high heteroplasmy, which means the
Could you explain?
mitochondria.
Could you explain redox for?
Um, Redox potential is that's like a whole that's a
Is it? Is
whole
it? Is
thing.
it good?
But
It's good to have it, basically, right? Yeah.
yeah, you want a you basically want to be you want to have a high redox state. That means your bioelectricity is functioning well. Um, it's the ability for your body to your bioelectricity to be functioning properly. It means your mitochondria are functioning properly. And when you get I kind of lost my train of thought. This is
No, that's
part of
okay.
it's
I've
all
actually got
about
a.
how it's like the pH in a cell can be measured into millivolts, which converts the the pH to electrons.
Got it.
And a low redox state, one way you can look at it is there's not enough electrons
Mm,
um,
mm.
happening in the body, and the water around the cell and in the cell is the most important, and the mitochondria needs electrons in order to make things like exclusion zone water. So something like a for example something like a pullback will cause a low redox state.
Makes
So
sense.
then the horse is more susceptible to other issues like um, maybe, they end up with skin issues or gut issues, or
Mm.
they just have, loads of other problems. And all these
Well,
things pile, like maybe they're fed grain, which the soy, wheat, corn base of grain is sprayed. Those fields are sprayed with glyphosate. So
yes.
glyphosate's a known mitochondrial killer, and then that will add an even lower redox state. So it's like a cascade. So you want to build, if that makes sense.
No, it
Um,
makes perfect sense because if anyone knows Poppy Phillips, Shay did a fantastic opening talk on her summit on EPM, because she touches on something that makes perfect sense to me. If there's been a head trauma, it's then the integrity of the structure is lost through the trauma. There is a more vulnerability for things to reach the nervous system and the fluid there. For example, something like EPM? Are we looking? And, Shay opened the door for a conversation to be had around the impacts of head trauma and EPM. I've often talked about, what about Cushing's? Is it true Cushing's, or do we have a head trauma? Is it true metabolic syndrome, or do we have a head trauma? Is it true insulin resistance, or are we looking at a head trauma that's causing this problem? Like as you're talking, Shay, I'm like, oh my God, we need to do a further webinar on head shaking. We are doing one on rugging.
yeah. Yeah,
I
and
have a question. I do have a
like the
question for you, by the way, Shay, before you go. Is someone has asked, is the exclusion zone part of the cell membrane?
yes.
Yes.
It surrounds the cell, and it's intracellular water.
Yep.
So
Perfect.
it's what's in between the cells. It's what coats the membrane.
Thank you. That's someone who goes by the name of Smith has asked that question. So thank you for replying to that. We are slowly coming to the end. Sorry, were you going to say some more things before I interrupted you with that question? Sorry.
Well, I was just going to elaborate on, give another example of the exclusion zone water, the low
Yes,
redox state,
do it.
the um, and EPM a lot of times is found up in the brainstem,
Mm-hmm.
and what gets pressure in a pullback, and
Exactly.
and when that exclusion zone water loses its structured state, things can enter that aren't supposed to.
Perfect. That's like gold. It's like you've gone, phew, I'll just put that there. I mean, certainly in our practice, there is often shock through the brainstem. Could be from
Yeah.
birth, could be from an impact, can be from a fall, and most definitely a pullback. Um, I've just got some more comparison photos for you guys to see. We have gone over time, but I'm going to open up the chat if anyone actually has some questions they'd like to ask both of us now. But here we have some before and afters from Shea's students, and that this is a level 1 again, isn't it?
Yeah.
Yeah, look at that.
Oh,
That
Sarah has been reading Tom Cohen's book. Yeah, I like Tom Cohen. He's
is a good
got
book, is
some
it?
interesting things to say. Yeah.
Add that to the list of books I need to read on my boat that's got a library on it. I was going to sail around the world and read my books.
Yeah, I was looking at the books this morning that I have, and I thought I want to read all of them. I don't know how I'm ever going to get through all that.
Well, that's our plan, isn't it? We're going to have a boat with a library on it
Yeah.
and just do webinars somewhere in the ocean.
Sarah said she recommends to her clients about preferred halters and ways to tie, and pleads with people never hard tie, especially with a rope halter. Yeah. I
Yeah,
used to train a lot with rope halters just because it was the type of horses I would end up were pretty difficult to handle. And a rope halter, I could do less, um, but I stopped using those and just used the soft.
yeah.
Um, and then Dawn asked, how are y'all clearing the shock out of the system using biodynamic CST? Yes,
Oh, that,
that's
yes.
that's what biodynamic craniosacral is. Um, Works on trauma in the fluid body.
Yep.
Yeah,
So,
I like the blocker tie rings.
yeah, they're good.
Yeah.
I agree about rope and soft. I tend to have my own this person on the left, she actually looks after a bunch of polo horses. She ended up after like meeting me and hearing about our talks, buying soft halters for all of the polo horses. You see this horse on the right. So they've all got them. But again, these are just examples really of that the body is living tissue and there's an intelligence in it and it is an ecosystem and fluid flow matters. And this particular horse on the left is like 18 hands high and he's hit his head. So and I'm 5 foot nothing. So
How on earth did you work on him?
well, I know. So I actually hung around his diaphragm and then
Mm.
the shock shifted. And then he took me to his hay and he ate some hay and he had his head low enough so I could just make some contacts around the head. And the
Nice.
picture on the right is what happened 45 minutes later. So, you know, it's fun.
And it's such a good example of not only the fluid restore the the coherent water domain being
Mm,
restored, and look at the shine in his coat, and
yeah,
his whole body doesn't even look like the same horse.
no, he was just like, but horses they're highly intelligent. You come in like, I mean, Shay's mentioned this before, you come in with orienting to the stillness in yourself and the stillness in them and with a soft heart. They know what you're there for. And even if it's been a horrible head trauma, they know that you're there to be with them and to allow that to shift into a better place, you know?
The Dawn, do you mean like working with the different tides?
I'll unmute.
Okay.
I'm an upledger craniosacral therapist, so I was just like listening to all of this, and I'm like, is it certain techniques? Is it more listening to the stillness? I'm familiar with biodynamic. I've had a lot of biodynamic work myself done on me. So, and
That's
y'all have really put amazing pieces together looking at the head trauma and how it is related to all the other aspects in the horse, well, and the human too, because I work with a lot of people with concussions.
you should go
And
and do one of Shay's classes. You could
I'm going to need some continuing education to work on horses in the new state that I live in. So I'm going to be looking for a class that will qualify me to work on horses in Kentucky. Where I used to live, no problem. Where I am now, new stuff.
yeah. Well, Shay, tell me what for those of you guys in the States, what are you offering over there?
I have online classes and which cover the same material as the in-person. Um, and I do offer in-person classes when it seems to be working out with the camp and timing and all that. I have a level 1 class actually next week that got really full. um, but I think to address your question and the biodynamic, we work with the slower tides.
Hmm.
Um, I've had
Yeah.
quite a few upledger people in my classes, and it's always fun because the my training was with Ryan Halford, who
Mm-hmm.
used to be he was an upledger teacher
Yep.
for a while, and then he
Yeah.
went, you know, um, we orient to the fluid body,
Yeah.
um, and the slower, more stabilizing rhythms. Um, if that helps.
That answers my question because I'm familiar with the
Great.
biodynamic
Okay.
paradigm a little bit. Not, I mean, clearly not like you. I'm very familiar with upledger paradigm because that's where I'm very trained. So that does answer my question, actually. I might have confused other people. I'm sorry if it
Oh no,
did.
that's okay. The tidal forces are a whole,
Mm.
um,
Yes.
yeah,
Yeah,
there's in the biodynamic world, there's 3 or 4 that we recognize, and then one that we orient to. Um,
Yeah.
I
It's
don't know if
for those of you who obviously, you're miles away and uh, you know your horse had a pullback. Craniosacral is fantastic for it in cranial osteopathy, whether it be upledger, whether it be biodynamic, whether it be visionary, whether it be osteopathy in the cranial field. And why? Because we are trained in cranial anatomy and the role of the dural meninges and the that we are able to sense when there's distortion and to help that find balance. So that's why, it is very important to get, maybe sacro-occipital technique, Cairo might be able to help. If you're a myofascial release body worker, if you do massage, certainly work around those suboccipital muscles will affect the deeper dural interface with the cerebral spinal fluid. Um, but it really, I think cranial osteopathy and craniosacral therapy are what you would need when there has been a severe head trauma and a pullback. That's my 5 cents, and I know we've gone way over time, so
Yeah, and
I
if you don't have anybody who knows any of that anywhere near you, then buy one of those red light bowl caps. Those are really
totally,
good.
yeah, absolutely. The red light will be talking to the mitochondria, right?
Yep. Yep.
I love it.
Yeah.
And of course, the practices, like you said, there's a lot of people like don't be tying with a rope halter, unless you've certainly got padding. Make sure you tie the right way. Make sure the horse isn't. You want to set it up really. If it's even if it's a new horse, that the horse knows where they are. They're not in an unfamiliar place. They can see when they're put in an area where they can't orient and can't see. There's a good chance they could get a fright. Um, and not, you know, especially if they're away from friends. So it's really case to case, really. And it's yeah.
Yeah. And Leslie asked what biodynamic craniosacral therapy books
We were
do you
talking
recommend?
about this the other day, weren't we? Well,
Yeah, I
if
just picked
we
up, I posted a book today called Stillness from Charles Ridley. Have you read that one?
I haven't, but he's awesome. Yeah.
It's biodynamic cranial practice and the evolution of consciousness by Charles Ridley
Oh,
called
some
Still.
light reading. I love it.
Yeah, it's it's beautifully written. It's like
I'm gonna get
poetry,
that.
like reading poetry. It's a really good one.
Thanks for that. I'll add that to my enormous pile of books. Um, you know, and if Shay and I live long enough, we'll be writing a book together.
If we can ever get um
Our shit together.
yeah,
No, that's
just
me getting my shit together. You already got your
I don't know.
right,
Having to
guys.
work
Look,
for a living can be a distraction.
I know all this work getting in the way. Far out.
Yeah. Thank you everybody for coming. And I
Yeah,
don't know if
thank you.
anyone has any more questions or anything.
3 more minutes if anyone has a burning question. I'm gonna pop this on my Vimeo channel, but thank you all for your attention and for coming on this little journey with us on pullback injuries. And Shay, massive thank you to you. I love doing these webinars with you. Thanks.
Yeah, they're fun. Thank you. And I'm it was so um fun to see everyone who showed up.
I
I'm
know.
always like, is anyone gonna show up?
Yeah, who's interested in this? All right, no more questions, everyone. I'm gonna close the chat and close the call. Thank you so much. Thank you for coming. Be an advocate for your horses, and if you're a body worker, check out pullback injuries. And yeah. All right. See you guys. Bye.